My name's Mark Folman. I'm a GP in Newark, and this is my first podcast talking about urgent care in Newark. This is my first ever podcast, and we decided to do something different last week after the design session, because the whole of the design of urgent care within Newark has been different from the start. The design group last week, where we had 70 stakeholders turn up, from patients, urgent care providers like the ambulance service, out of hours, GPs and the hospital, was completely different to any other design group I'd ever been to before. Normally, when you go to a design group or a design event, there is a plan for you to critique. This time there was no plan. This time you had to come up with the plan yourself. There was no sort of secret plan by the people running the event or anything like that, which people found difficult. And I think some people found frustrating as well. However, it was a really useful day. At the end of the day, we had a rough direction of travel. We then had a follow-up meeting on Thursday with, after the Tuesday design event, we had a follow-up meeting on the Thursday. This had representatives from both the hospital and the CCG. We reviewed the charts from the outer groups, which they produced on the Tuesday. And we also looked at the plans that we started to develop in the central group on the Tuesday. We looked at what was achievable now and what we needed to test. We came out with three main things that we wanted to test first. The main idea of doing these tests is just to see whether things work or not, and whether there are other barriers that we haven't realised were there are actually there. The first thing we're looking to test is using the ECP more. We are going to look to see whether the ECP can do some of the urgent GP visits needed during the day. We will look at this, see if it's safe, and see if it works well, as this may release the local GP to be able to do other work. The second thing we're looking at is a unified triage service for the whole of Newark. This should hopefully remove some of the confusion about urgent care services within Newark. And the final thing we're going to test is having a GP working in MIU. The main reason for this is the out-of-hours GP, when he works at Newark Hospital, tends to work round the corner and in complete isolation. If the GP and the hospital can work together, that can only be a good thing. It should allow for increased flexibility in the system, increased sharing of knowledge, leading to an improved patient experience. We're wanting to start testing this stuff over the next couple of months, and we'd be really grateful for people's feedback on how well they think the changes are going and whether they think anything else needs to be done. We're doing this very slowly. This is to make sure we don't make any mistakes and things are done safely and well and right.